everybody, how are you? I hope you're well. My name is Terry Favored. Karibu sana. Welcome to this channel. If you're new here, Karibu sana. If it's your not even the first time, if you've been here, watched our videos, it's your second or the third time or the fourth time or 100th time, Karibu sana. Thank you for supporting this channel, because every time you watch a video, every time you give me a thumbs up, you give me the motivation to do more videos and to work on more content that is going to help you, especially for mothers. So on this session, it's a continuation of our motherhood session number 3 on cesarean section, and today we discuss when to call the doctor or the danger signs, things to watch out for after cesarean section. So I want to welcome you. I want to give you like a few seconds so that you can subscribe to this channel. So take your time, hit that subscribe button down there and get notified every time I upload a new video. So now on to our topic, things to do or when to call your doctor after cesarean section. So when do you call your doctor? Number one is when you feel depressed, when you feel sadness, hopelessness, or you are having troubling thoughts. Anytime you feel like you have sadness or hopelessness or having troubling thoughts, call your doctor. Then the other point is when you have signs of infection, which include pain, pus, swelling, redness, swollen lymph nodes, or a fever. So if you have the above, those are signs of an infection. Remember, in the previous video, we have discussed about infection, which is very common if you're not careful, which can be out of poor hygiene, or it can be out of just normal infection. So the other point, when you have a fever, if you're having a fever, please call your doctor. It is very, very dangerous, and make sure that you don't ignore, because it can be fatal. The other point is when you're having difficulty in breathing. Remember, C-section is a major surgery, so you have to be very careful in whatever you do, whatever you feel. If you feel like your body is not okay, let doctors check on you. That is why you're given like a few days, up to 5 days in the hospital after the C-section, so that you can they can continue watching you, and by the time they discharge you, they feel you're comfortable to go home and continue taking your medication from home. So the other point is when you have discharge from the vagina that smells bad. If you have a smelly discharge, that is a sign of an infection. Please call your doctor and let them tell you what to do, and if it's going to go back to the hospital or seek medication, please do. So the other point is severe pain in your belly. Remember, there is pain after the infection, but not severe pain. So if you have severe pain in your belly, could be something is wrong, and do not hesitate to call your doctor. The other point is bright red vaginal bleeding that soaks through more than one pad every 2 hours or less. That means that you're having a lot of bleeding, which is dangerous because you lose a lot of blood. So if you have bright red vaginal bleeding that soaks through more than one pad every 2 hours, please call your doctor and seek help from your physician. So the other point is vaginal bleeding that gets worse or is still bright red more than 4 days after you've had your baby. So remember, the vaginal bleeding it actually reduces with time. And especially when with C-section, you find that they've already cleaned your womb. They cleaned you. So it's not supposed to take that long for you to stop the bleeding or for the bleeding to go down. So if you still have the vaginal bleeding that is red and gets worse for more than 4 days after the operation, please call your doctor and let them know that you having the vaginal bleeding. And the other point is signs of blood clots, including pain in your thighs, groin, back of knee, or calf. Please, if you have the signs of a blood clot, which is pain in your thighs, groin, or back knee, or calf, please call your doctor and seek immediate medical attention, because blood clots are fatal. So the other point is your incision comes open. Remember, in the other video, we have discussed on things to do or not to do to avoid your incision coming open. So if your incision by mistake, if your incision comes open, please seek medical attention immediately. Call your doctor and let them give you the way forward, or go ahead. So the other point is nausea and vomiting. Remember, you're not supposed to have nausea or vomiting. Sometimes vomiting or nausea can happen immediately after the operation, when you've taken food. So you might experience some vomiting, but please, even if you have the vomiting or the nausea, make sure that your doctor knows. And if you've already been discharged, please let your doctor know and let them advise you on the way forward. So the other point is vaginal clotting that is larger than a golf ball. So vaginal clotting, there are clots. If you're careful and you've also realized that when they're cleaning your womb, they are clots. They clean you so that the clots can reduce. And remember, we said clots are very dangerous because they can block the arteries and they can cause you to something fatal, which is not a very good thing. So what you do, if you're having vaginal clotting, the balls that come out, the clots, you understand what I mean, the clots that are bigger than a golf ball, please make sure to call your doctor. And the other thing is, if you have trouble passing urine or stool, if you have trouble passing your urine or stool, could mean that there is a problem. There's something that went wrong during the operation. So make sure, if you are unable to, make sure you call your doctor. Make sure that they know you have the problem. And that is why during your recovery period, that is the first 3 days after the operation, you're told to go and try and go to the toilet. Yet you're told to go and try passing stool and urine so that they can monitor you in case there's any problem. So if you have that problem, make sure you call your doctor. Make sure if you're in hospital, make sure you notify your doctor. And if there's anything to be done immediately, it can be done. So the other point is taking care of yourself. Having a C-section is just as important as taking care of your newborn. So allow yourself to take it easy, rest whenever possible, and call your doctor if you have concerns about your health. So this might not be the only points that you're supposed to call your doctor when you experience any of the above. But if maybe you have another point that I've not included, please let me know in the comment section. Let me know that there's a point that I've left out, so that we can help one another, so that we can be aware of what to do. You see, knowledge is power. So just let me know in the comment section, and let us work together as mothers, because you know these are common things. C-section has become a very common operation, and please don't be ignorant. These are things you're supposed to do, because the factors that I've discussed above, the points that I've discussed above, they could be telling you that there is a problem. They could be notifying you that there's something that went wrong during your operation. So make sure and take note of the points, take note of the signs, take note of what you feel, take note of anything that you feel your body is not okay or you feel is a concern for you, and let your doctor know. So guys, if you like this content, please like this video, comment, and let me know what you think. So guys, until next time, my name is Terry Favored. I'm so happy to have been together with you. So kwaheri, don't forget to subscribe.